also on how we make our PO or prescription orders. So you can you can copy this number and we can uh, check these areas here. You can review those areas here based on yung guidelines natin. And now, under our guidelines, we also have our parts of our prescription. So, I think hindi naman new sa inyo ang prescription order, yung parts of the prescription. Kasi this one has been, ano na din, given to you or discussed to you um, uh, during your uh, pharmacology, if ever, Gen Pharma. Am I correct ba? Meron na bang i-discuss sa inyo before about sa prescription order?
Doc, yung pina-assignment nyo lang po.
Nung General Pharma, ay nung Ocular Pharma?
Opo, Doc.
Oh, ganun. Okay, so I think dito kasi sa FDA, wala kasi siya dito sa pharmacy terms. Okay, so let's just go over yung parts of yung prescription order ninyo so that after that we can go for yung mga types of prescriptions na pwede nating gawin for our patients. Okay, so for your parts of your prescription order, of course, we have yung practitioner's information. So the practitioner's information contains the following, which is yung name mo, name of the practitioner, yung degree niya, if the practitioner has a specialization or specialty, it is included also. The patient ulit, the practitioner's address, of course, yung contact information niya, which is yung telephone numbers and cell phone numbers. Affiliating centers, also yung mga affiliates niya, just in case patient needs a much neater or much more convenient area that you are also practicing. Yung license numbers niya, PTR numbers also, or professional tax receipt numbers, and S2 numbers. Yung S2 numbers is some sort of ano na to, licensing number for controlled drugs or Schedule 2 controlled drugs. So you must have this S2 number to be able to prescribe some select prescription medications that are controlled substances also. So that is yung that is yung area for practitioners information. The second one is of course your patient's information. Includes the following, which is yung patient's name, yung address, age, and sex or gender. In some parts of the world, they usually do sex and gender. Kasi in terms of yung patients or some people who would like to identify as this, identify as that. But in terms of medical conditions, we really need to do also patients through sex and gender also. The date also, the date when this prescription is written. Of course, here we also have your superscription, which is represented by the the symbol RX. Ay, meron pala akong PO dito. Okay, so here we go. So in this area, so the PO, yan. So andito tayo sa practitioner's information dito sa pinakataas. So here, ay wait lang. I think we can do a different portion para at least ma-edit natin later on. Ayan. So there. So ayan. So here we have your prescription order. So here is your patient tuloy. practitioner, Dr. Emily Ong, an OD, and also a specialist or contact lens specialist or an affiliate also of IACL or International Association of Contact Lens Educators. Dr. Emily is an optometrist and a contact lens specialist. So under here, we also have your practitioner's address, and dito sa bottom portion will be yung contact numbers. License numbers and PTR numbers, S2 numbers are usually seen here, down here. And of course, yung signature niya andito sa area na to. This portion here on the lower right. And going back to the upper right portion, dito natin nilalagay ang affiliations ng practitioner. It could be here on the top right. It could be actually on the center kasi minsan madami siya na ano. But most likely as long as after the patient practitioner's name kung saan yung affiliations niya. It will always be before the patient's information, yung practitioner's information. So down here, also we have your patient's information, which is your name, address, yung age niya, yung sex niya, and date when it is written. The date could be here on the lower portion where on the patient's area or actually on the upper portion also. But usually for prescriptions, dates have been added here in this area near the patient's information para to solidify that yung date written mga ganyan na ano na concerns kasi most of the time uh, dates are important for some uh, diagnostic drugs or some S2 controlled drugs or some controlled substances, and it's for you to keep track also when it is written and when it has been taken bought sa pharmacy also kasi there are some prescriptions that require you also to buy the prescription medication only within 2 weeks or 7 days upon issuance of yung prescription ninyo. Okay, anyways, so we also have yung in this area of yung okay. Anyways, we have yung superscription, which is over here in this area. Ito is represented by the symbol RX, or actually this one is supposed to be a small x like that. Okay, and this is ano na yung definition niya is somewhat of a word recipe or meaning you take. And below this one is yung inscription, which contains yung following, which is yung generic name that may include yung trade name ng drug, yung concentration niya, and yung dosage form niya. So here in this sample, we have a diagnostic DPA, which is tropicamide, and we are going to use a 0.5% solution, and yung trade name niya Midriasil, and yung dosage form niya is a number 1 dispenser. And below that one also is yung subscription. Direction given to the pharmacist to specify the numbers and type of dosage units to be dispensed. So in this case, ang ano lang naman dito is for example, for this type of for this type of ophthalmic solution, we usually just include here just one bottle, or for some kasi na some medications, we go by capsules or go by by certain number of tablets, mga ganyan. So after the subscription, we also have yung signature or SIG, or another word is transcription. So SIG, this will now refer to the direction to the patient on how the medication is to be used. But here, in this case naman sa tropicamide, this is an instruction for the practitioner when we are going to do some diagnostic tests using 0.5% tropicamide. So you are to instill one drop or GTT or GUTA every 5 minutes for 3 doses until your patient has achieved full dilation. So, yun yung for our SIG. And for some medications, also meron tayong labeling or refilling information, or yung dun sa before yung labeling and refilling information, ay after yung labeling and refilling information, andun na din yung prescriber signature, license numbers, PTR numbers, and yung S2 number. Dito kasi na prescription, we do not have any refilling information or refilling information here, kasi this one is a prescription for a diagnostic agent. For some prescription medications, or some areas kasi, or some countries, they have a refilling information, and dito sa refilling information ninyo makikita yung schedule kung kailan ninyo i-refill, or yung assigned schedule as to when your patient will return sa pharmacy for refilling of their prescription bottles. Okay, so next we also and that would be for your parts of yung prescription order. So what do you nandito din yung mga abbreviations dun sa binigay ko na materials ninyo dito sa G-class, kung ano yung usually na nilalagay natin na na terms, such as yung mga um, yung mga abbreviations and terms, ganyan. So, we move to yung parts naman, or types ng prescriptions na we can do for our patients. So, different annexes also kasi ito. Annex A would be yung pinaka-valid pinaka-usual na prescription natin na ini-issue sa patient natin. This is yung valid ophthalmic prescription that is to be issued to your patients, which contains yung optometrist information, yung patient's information, date of examination, and your diagnosis. So we go back to this area. We just edit this out. For example lang ang ano naman natin here is we have done some tests for your patients for ano na to wait lang. Tests for your patients to determine a certain type of disease and yung management, ganyan. So we have to include here your patient's diagnosis. So for example, you have done some tests or procedures to determine your patient's current condition with regards to their low vision. So ang ano ninyo after much na tests ninyo, you have discovered that your patient is visually impaired secondary to retinitis pigmentosa. So ang ilalagay natin dito is just that, visually impaired to retinitis pigmentosa. And below this area, we usually do yung we also include here is yung management niya. So for patients who are visually impaired due to or secondary to retinitis pigmentosa, it usually depends on the severity or yung type ng ano niya ng retinitis pigmentosa and the amount of vision loss that the patient has for both eyes will determine kung ano yung usual na ano ninyo na managements ninyo. For example, we just do some optical aids. There are a lot of optical aids that we can use for your patient. We also do some non-optical aids also for managing your patient's retinitis pigmentosa. So here, this could be also your usual prescription for your that you can give to your patient na ano for purposes of filing or dun sa mga to claiming niya or for filing ng mga reports for medical records or medical insurances, mga ganyan. So this one is Annex A. So Annex B naman is a contact lens prescription. So for contact lens prescription, we have a sample also for your contact lens prescription. If you have any of you seen ba yung patient form ng clinical contact lens before? I think for some kasi, for example, si Ayla, naging patient ka din ng ng mga higher years before, there is a certain prescription order for contact lens prescription. Kasi almost the same naman siya. There is andun yung optometrist's information. Um, yung name of the laboratory and yung LTO number ang isang ilalagay na additional dun sa prescription. So yung LTO number is LTO number 3. Kasi madami tayong types of licenses or LTO, license to operate, LTO numbers, and almost all of our laboratories, be it lens, ophthalmic lens, contact lens, or yung mga lens solutions, they each have their own LTO numbers that needs to be included dun sa prescription order niyo for uh, this area sa contact lens. And after that, after the LTO number, doon na din yung patient's information and yung date of examination and yung specifications for your contact lens. So yung specifications for your contact lens ninyo will supposedly include yung power, of course. Yung second one would be yung I think we can just kasi wala akong so yung sa CL prescriptions, this one will require you to uh, so sa CL prescriptions, we have yung first one will be yung power. Another one would be yung BOZR or back optic zone radius. Yung BOZR niya. Ano yung other name natin for back optic zone radius? This one will be yung base curve. For some prescriptions, say Ortho K or uh, ke, Kerato, Kerasoft IC, mga scleral contact lenses, we also need to do yung PCR niya or yung peripheral curve radius niya. Very important ito when we are going to dispense ortho K lenses, Kerasoft IC lenses, or in general mga scleral lenses ninyo. Next would be yung lens diameter, of course. Kasi um, there are some patients that need some modified or custom-made contact lenses with a certain diameter because of their ano na to, because of their VVID or HVID being a little bit more smaller than your standard na na iris diameter. So next also for some prescriptions of contact lenses, this one is also needed, yung water content niya. Um, it's usually in 78%, 68%, mga ganyan. Higher water content is present for contact lenses of a lower modality. So, include din ito. And of course, yung lens replacement schedule niya. So, yung replacement schedule niya will be placed here also. If this is a conventional contact lens, which is usually around 6 months, there is also 6 months, or for some hard lenses, this is for 10 months. Ganyan. We also have monthly disposable contact lenses. We also have yung, if ever kung monthly disposable, we also have what we call yung extended wear. Keep in mind, ang word na extended wear are for contact lenses that can be used when you are going, when the patient is, uh, can be worn even if the patient is sleeping. These are yung extended wear contact lenses. And currently dito sa Philippine market, there is only one brand ng contact lens na pwedeng maitulog, which is yung Air Optics Night and Day. So, ilalagay ninyo dito if it is a conventional lens. This one is 6 to 10 months or 6 months, 10 months, mga ganyan na replaceable siya. We have extended wear. When we say extended wear, this one are the contact lens. These contact lenses are the ones that can be worn even when the patient is sleeping. We also have monthly disposables, so can be worn up to 30 days. After that, dispose agad. We also have 2-week disposables. This brand has higher water content than daily disposables, but a little bit even higher water content compared to monthly disposables. And this one is yung brand na AccuView Oasis. So these are usually worn within 14 days lang. After that, dispose agad. And of course, yung daily disposables. Yung daily disposables naman, good for 1 day for each pair naman siya. A maximum of 12 to 14 hours naman siya. Some patients can go longer pero the irritation is a little bit more noticeable na after the 14-hour mark. Another pwede niyong ilagay dito sa replacement sked is just in case your patient has hard lenses. So for hard lenses, ang ilalagay ninyo dito na replacement sked, possible naman na hindi replacement sked ang ilalagay ninyo. Polishing schedule. Kasi usually for hard lenses, mas malaki or mas mabilis ang build-up niya or mas blurrier siya or mas noticeable yung build up dun sa hard lenses. So, especially if your patient is suffering from dry eyes, meron talaga tayong manonotice na build up later on, which will be usually within the 6-month mark of use dun sa hard lenses niya. So, you collect yung lenses niya and then you forward it to your laboratory for polishing para ma-remove yung build-up. Kasi sometimes those build-ups cannot be removed by the use of yung mga peroxide na agents or yung mga intensive cleaning solutions natin. So we go for polishing naman. So, after that, we also place yung brand niya, of course. Kung anong brand ito. Is it Air Optics? Is it Belcon Toric? Is it Dailies Aqua Comfort Plus? Is it Seed? Is it AccuView? Mga ganyan na brands. And of course, yung type ng contact lens niya. So, is this a soft lens? Is this a GP lens? Is this a hybrid lens? Is it a specialty contact lens? So for specialty contact lenses, these are yung Kerasoft IC, mga ortho-K lenses, scleral contact lenses, hybrid type of lenses, or specialty contact lens na yung piggyback lenses, which is a hard lens on top of a soft lens naman. Yung design niya, of course, ilalagay ninyo din dito. If this contact lens is a toric design, single vision design, is it a multifocal design, is it a multi-curve design type of RGB lens ninyo. Okay, and the next one is yung material niya also. Very important to include yung material. Bakit pumunta siya sa kabila? Okay, so the last one is yung material. So what type of contact lens ano yung material niya? Is it a um, hydrogel, silicone hydrogel, or is it a type of GP, which is PMMA methyl polymethyl methyl acrylate, polymethyl methyl acrylate, or is it a fluorosilicon acrylate? Ganyan na Uh, mga ganyan na material types yung ini-include natin here. So that is for Annex B. Another area for Annex B na for prescription is yung previous na nilagay natin here, which is yung ophthalmic solutions. So for ophthalmic solutions naman, same pa rin, optometrist information, uh, manufacturer, LTO number, and of course yung patient's information. Date of examination is also placed here, and yung ophthalmic solution na i-include natin. So for example, we are going to go for lubricants ang i-include natin or ilalagay natin. So can you give a different a brand of a lubricant beside Systane? Okay, so we can go for CelluFresh. So CelluFresh, I'm pretty sure CelluFresh will be hydroxyethyl. A ah, Hindi siya hydroxyethyl pala. This one is carboxymethyl cellulose. So we go for CelluFresh. So ang include natin here would be dito ilalagay natin yung generic name niya, of course, carboxymethyl cellulose. And after yung niya, ilalagay ninyo din yung trade name niya, which is CelluFresh, or yung brand name niya in this case, which is CelluFresh. And in this case naman, for lubricating solution, hindi naman na kailangan yung COMDR, or Certificate of Medical Device Registration. Some prescriptions or some diagnostic pharmaceutical agents require you to input or include yung COMDR niya. And of course, yung indication or usage instructions. So let's go back dun sa previous na PO na ginawa natin. which is this one. So, yung sa PO na ito, ang kulang lang naman dito sa area na to is yung COMDR. Pero included here is yung torpicamide in 0.5% ophthalmic solution. Andito din yung brand name niya, Midriasil, and yung concentrate or yung type ng ano niya, ng dosage niya, which is a number 1 dispenser. And indication of usage or instruction is usually placed also here, which is yung signature or yung transcription, which is yung instruction on how to instill for ano na to, dilated fundus exam. So instilling one drop every 5 minutes for 3 doses until fully dilated. Next one, under Annex B pa rin is contact lens solution prescriptions. Unfortunately, even contact lens solution sometimes needs some prescriptions also. Kasi there are some solutions that have a certain instruction as to how you should use them. Kasi, for example lang naman, ang ano naman, medyo simple or easy na ophthalmic solutions would be yung mga regular solutions na may saline lang, which is yung Optifree Pure Moist, yung mga All Comfort, mga Lens Care, New Look, Manicon Progent, Manicare Plus, mga ganyan. But there are some solutions also that are kailangan ng instructions when we are going to use them, which is, for example, si Manicon Progent. Another one also is si AO Sept, which is a type of solution or intensive cleaning solution, which uses hydrogen peroxide. So, under dito sa contact lens solution prescription, andito pa rin si optometrist's information, name, clinic address, number, license number, professional, yung PTR number, of course yung LTO details mo din, license to operate. And yung sa below that is your patient's information. And after the patient's information, dun yun na din ilalagay yung contact lens solution, yung parameters and specifications niya. So, yung brand name, type of contact lens solution. So, it is a ano na to? Intensive cleaning solution or daily cleaning solution ang usually nilalagay natin. Daily lens care solution or intensive cleaning solution. And yung COMDR ulit, kailangan natin nilalagay siya. And yung indication and usage instruction. So for usage instruction or indication, pag daily lens care solution, yung usual naman na inaano natin, which is pangbabad siya for daily replacement. For some patients naman, kapag hindi naman nila ginagamit for a long period of time, nakababad lang siya. Always include also or instruct your patient that every 3 days you have to recheck your contact lens case to see if your um, solution has lessened or nag-dehydrate siya. So always refill after 3 days of ano yun, idle na hindi siya nagamit. For intensive cleaning solutions naman, for example, si AOSEP, you have to include also here yung instructions to let your contact lens sit on the special container ng AOSEP for at least 6 hours or overnight. For yung para yung peroxide can be neutralized properly, and once your patient will wear their contact lenses without washing with a daily lenswear solution, hindi siya magkakaroon ng irritations. For yun yung para sa AOSEP. There's also a different type of intensive cleaning solution, which is yung Menicon Si Menicon Progent naman can be instructed to parang i-place niyo lang siya sa special container din niya. And you have to mix yung ampule A and ampule B inside the container and mix it well or shake it well dun sa container with yung contact lenses already inside the special container and let it sit for 30 minutes and 30 minutes only. Kasi compared to AOSEP, which uses hydrogen peroxide, Menicon Progent uses a type of bleach to clean and intensively clean yung hard lenses ninyo. So, it is imperative and important that you only uh, use it for just 30 minutes. And si Menicon Progent is only used for um, contact lenses or RGP contact lenses, rigid lenses lang siya. Kasi if you were to use this for soft lenses, it would dissolve yung soft lenses ninyo. Okay, that's for contact lens prescriptions. So, last one, which is, yes, this one is the last one. Last one is yung DPA, which is Diagnostic Pharmaceutical Agent. So, we can also use this prescription, yung current na naka-flash sa inyo, as yung instructions ninyo for DPA or Diagnostic Pharmaceutical Agent. So for DPAs, some DPAs kasi in terms of other countries, they have a certain type of DPA that is an S2. So kailangan na included din talaga yung instructions later on. So optometrist information again, which is this area. Patient's information and before the patient's information, again, ilalagay natin ang LTO number natin or license to operate. And yung date of exam, after done, the patient's information, we have yung date of examination and yung prescription, which is yung DPA, diagnostic agent or generic name niya, tropicamide, brand name, Midriasil, and yung COMDR ulit, Certificate of Medical Device Registration. After this one, of course, yung SIG, which is yung instruction on how to instill yung prescription, ay yung medication na ito. So, instill 1 drop every 5 minutes for 3 doses until fully dilated. Okay, so that is almost all of yung ano ninyo for the prescription order. So, I think na-improve naman siguro or na-increase sana yung knowledge ninyo for making your prescription order compared to your previous na lecture na naipa-assignment lang sa inyo. Carry ba? Nako, parang na-mental block ata kayo ulit ah. Okay, so we are going to go for yung last leg lang naman here. Kung ma-open niyo yung document which is yung pharmacy terms, meron lang extra na area dyan which is yung mga controlled substances. So for your controlled substances, asan yan? So pharmacy terms, ayan. So for pharmacy terms, andito yung terms natin which is dito sa first one, in terms of yung abbreviations andito sa center. Ito yung nilalagay natin dun sa prescription, the Latin meaning niya, and of course yung meaning niya din. So for example, as you go here sa HS, this is usually instructions for how the patient will take yung medication niya. So HS, which is orasomni or horasomni. Take note also that this one is yung take note of also how you use capital letters here, kasi there are certain there are certain instructions for capital letters and small letters also. G or GM is gram, yung HS horasomni, which is translated to be taken at bedtime. or kumbaga before bedtime actually, yung itong si Horasomni. Noct or noct, and a period would be at night. Um, Q, a capital Q, ha, which is quack, quack, for each or every ang ano niya. But if it is may kasunod siya, which is uh, Quakehora, uh, QH, this will now be a small letter. QH, which is every hour. RX naman, recipe, meaning you take. Signatura, signature, or sig, write, you write. Or the current instruction on how to instill yung agent or yung medication, or how to take yung medication. So, below here, now, kasi 'di ba meron tayo dun sa prescription order is yung S2 number. So there are certain schedules or certain controlled substances that require you to have a S2 number or certification for you to be able to dispense them. This one is actually a somewhat of an hindi. Still updated pa rin naman ito na um, type of medications for S1 to 5. So for S1 or yung high C1, these are substances that have high abuse potential and no accepted medical use. For example, here is the marijuana, heroin, lysergic acid lysergic acid diethylamide or LSD, mescaline and tetrahydrocannabinols, or some sort of medica or parang medical grade or concentrated marijuana, itong si tetrahydrocannabinols or THCs. These are yung guidelines for S1 are currently they are not available for therapeutic use. However, for S2 medications or drugs, these are also medications that have high abuse potential, and abuse leads to severe psychic or physical dependence. So, under here, some examples are Demerol or Meperidine, cocaine, morphine, methadone, amphetamine, phenobarbital, and secobarbital. Prescribing guidelines for these type of medications are only available in a written prescription signed by the prescriber and must be supplied within 72 hours. Cannot be refilled unless in case of emergency, or unless in terms of yung sabihin natin na in case of emergency is under the instruction din ng um, doctor niya. So, ito yung sinasabi ko na yung refilling information or yung date is very important kasi some controlled drugs require them to go and claim or go and get yung prescription within 72 hours upon issuance of yung contact lens prescription to medical prescription or medication. So S3 naman. So for S3 or C3, these are medications that have less abuse potential, but abuse may lead to moderate or low physical dependence or high psychological dependence. This one is codeine or hydrocodone. Codeine is a type of cough syrup that has been used in some countries. Dito kasi sa atin, it is still a controlled substance, si codeine. Yung prescribing guidelines naman for these type of drugs cannot be refilled more than 5 times or be dispensed or refilled more than 6 months after the date of the prescription order. So it's either kailangan lang ng patient ninyo 5 times lang ang refill ng prescription niya. Kasi sometimes si codeine can be in a capsule form or a syrup form. When in a syrup form, usually this can last them up to parang once a month lang na magagamit nila yung codeine. Yung capsules naman could be in a form that can be uh, ano na to, can be used for your patient at least 2 weeks a month yung ano niya, yung duration niya. Or actually 1 week lang. 1 week a month lang siya. And then go for follow-up checking na lang ulit. Another one, next is yung Schedule 4 or C4. These medications have less abuse potential and limited physical or psychological dependence. But andun pa rin. They can still have physical or psychological dependence. These ones are diazepam, alprazolam, clorazepate, or phenobarbital. Prescribing guidelines can still be the same as Schedule 3, which is ganun din, may not be refilled by more than 5 times or be dispensed or refilled more than 6 months after yung date ng prescription order niya. The next one is C5 or Schedule 5. Limited physical or psychological abuse potential, but it is still there. Pinaka number one example here or most noted na highest na abuse potential is loperamide. I think some of you have been using this one or have seen this medication before also. Si loperamide under diet tabs. Ay, hindi. I think there's the other na name. Hindi si diatabs kasi medyo later on ito. Imodium. Si Imodium. Kasi si Imodium has had different types of concentrations or different types of formulas also, but most notably Imodium in the formulation with loperamide has been a highly hindi naman sa highly pala, has been noted as one of yung medications that have psychological abuse potential dito sa country natin, loperamide or yung Imodium. And the next one is Robitussin AC or sa atin naman is Robitussin yan. Robitussin AC. Pero this one is a hindi siya over the counter type of Robitussin. Kasi I think we also have yung sa atin dito is guaifenesin lang siya. Yung meron sa atin na Robitussin na over the counter. Meron kasi yung Robitussin na merong codeine. Meron siyang included na low concentration of codeine to improve yung ay to lessen yung activity ng pag-ubo sa patient. So, for prescribing guidelines, dito kasi only loperamide is dispensed without yung prescription order. Robitussin AC needs a prescription order and a certain instruction on how to instill or how to take yung Robitussin AC. Okay, so that would be the end of our discussion for your prescription order. Are there any questions in terms of yung sa pag instill or pag-write ng prescription order? Speak now or forever hold your peace again. Okay, so if you do not have any questions for this one, I will be giving a activity at the moment. So I will be posting it now and we will be ending the class also. After ending the class, you have to submit this within 20 minutes. So in a white sheet of paper, again, ayoko ng yellow paper. You write down a prescription order for a patient who needs to have a dilated eye examination with the use of atropine 0.01%.
Doc, atropine 0.01%.
Yes. Yes, Shaira.
Magpapaulit lang din po ng question pero na-ask na po ni Ate Guani
Okay.
po.
So instill a atropine 0.01%. So same dosage instruction, but this one will only be 1 drop per eye every 15 minutes for a total of 4 cycles until fully dilated. Okay, so write it down in a white piece of paper and then submit it in the current na class work na ipopost ko. And nakasulat is prescription order. So this one is worth 30 points. You can make up kung anong affiliate nyo, anong license number ninyo, PTR number. And the second one na ninyo, na prescription order. So that's the first one, 0.01%. The second prescription order would be for your patient to use Menicon Progen. A prescription order or a prescription order for a ophthalmic solution, which is yung special ophthalmic solution, which is Menicon Progen. Include there yung instructions, include there yung type ng ng solution na ito, and yung mga ito, cautions niya, of course.
Doc, anong spelling?
Ay, sorry. Okay, so kung Menicon Progen, Menicon. Menicon. And yung Progent is Progent. Okay, so after this, I will be assigning na siya. Yan. Okay, so it is already posted for you here. And then after that, write down your prescription, take a photo, as much as possible. Kung kaya ninyong mag-cam scanner, mas okay na i-cam scan ninyo. Kung hindi, please take a photo of your prescription order or your assignment at a very illuminated area para at least mas makita ng mas maigi yung sa mga sulat ninyo. Kasi alam niyo, singkit ako, medyo mahirap na nga din napasingkitin yung mata ko pa. Yes, Samuel.
Doc, dun sa sa prescription number 1,
Mm-hmm.
yung dun po sa naputol kasi 1 drop of every.
1 drop every 15 minutes for a cycle of 4.
Okay, Doc. Thank you.
Okay. Sige. I will be ending the call na and you submit your prescription order by 9:15.
Doc, may PM ako.
Ay, hindi kasi nakalagin sa PC yung Anyways, okay. Okay. Sige, you can go na. I will be seeing you na din sa finals ninyo this Friday. So, nakapag-schedule na ba kayo ng dry run ninyo, Shaira?
Hindi pa po nag-reply din doon sa question ko po ng Friday if available din po siya, Doc.
Okay. So,
Pero
hopefully
pero
kung
nasin naman po, hindi ko lang po alam kung nakalimutan po nila
yeah,
akong replyan.
follow up mo lang ulit kasi malay mo
Yes.
para tulad ko siya na mentally nagre-reply.
Po, yes po, Doc.
Okay,
Iulit ko.
so so if ever afternoon no yung dry run ninyo.
Yes po, Doc. Para
Yes,
nandoon na din po kayo.
Jase.
Doc, clarification lang po. Hindi ko narinig kanina. Yung final exam po sa Optomed sa Friday is written exam po. Included po ba yung mga preliminaries na ginawa namin?
Mm-hmm.
Ay, yung practical exam
Mm-hmm.
hanggang po ngayon na
Yes.
discussion?
Yes. Oh yeah, and of course about pala sa ano ninyo, sa practical exam ninyo, at least that's a nice improvement naman from your previous. That's congratulations sa inyo kasi at least na-improve ninyo. Although you still need some improvements, do hope that you can improve more pa. But that is nice kasi at least you have done your best to improve compared dun sa compared dun sa previous ninyo. Kasi in terms of percentage, medyo drinaf ko din kasi yung percentage ninyo from yung previous na exam ninyo. Yung first na practical exam ninyo, parang ang rate ninyo per person is around 35%. Parang a select few lang ang nagkaroon ng around 60 to 70%. So ngayon, pinaka max ninyo is naka 70% naman kayo, which is still nice. So at least that is a good improvement from your previous from 35 to 70. That's already a good sign. Have to improve more, ha? Pero at least this is a good improvement for all of you. Okay, so are there any more questions at the moment? Ooh, yes, Diana. Yes. So, in terms of cover to cover sa CL, ang naidagdag lang naman, I think, is yung, ano na to? Ang naidagdag na hindi nyo lang na exam before is yung sa multifocal. And of course, dito sa Optomed, preliminary examination, case history, how to deal with a challenging patient, and of course, your prescription order. Prescription order, and of course, itong si guidelines ninyo din sa FDA. Circular 2021-0021. Ay, 021 pala.
Doc, last na po.
Yes.
Ano po yung type ng exam? CL and Optomed po?
In terms of wala, I will just say lang siguro na walang enumeration. There is a possibility of it being a multiple choice, true or false, and identification, pero walang enumeration. For that would be for yung CL. Same din dito sa Optomed. Ang ano lang siguro ang difference kay Optomed, there would be some sort of essay writing for Optomed. Okay, any more questions?
Doc, may PM ako ha.
Yes, nakita ko. Okay, if there
Doc,
are
ako rin, may PM po ako.
Sino? Ay, okay. Sige. I'll just check these na lang din. And later on, sige, we extend it a little bit. So 9:20 ninyo i-submit yung prescription order ninyo. And if there are other questions also, you can just message me later on. Aside from that, also do not remember what you should bring during your final exam. para hindi kayo magkakaroon ng problems later on. And then, after that, I do hope that you, ano, kasi I think almost all of you have improved naman sa contact lens of the med. But, konting push for each and every one of you. Kasi at least, I think papasa naman. Pero sana naman taasan niyo pa ng konti para mas sure tayo. Okay, if there are no more questions, you can go na din. Don't forget to submit your activity before the deadline, okay?
Noted po,
Yes po, Doc.
Doc. Thank you.
Okay, sige.
Thank you po.
Okay, sige. Bye-bye na.
Bye, Doc. Thank you po.
Bye-bye po, Doc.
Bye po, Doc. Thank you.
Thank you, Doc.